Good day. I'm Dr. House DDS. Did you know that the most common cause of unconsciousness in dentistry is syncope? With that known, what causes syncope? How can we avoid it? How can we manage it? Let us look at syncope in a non-clinical setting to help us understand it better. Our story today begins with Anne, an energetic, physically fit young woman who loves to exercise. She is calling her friend Mark, who unfortunately is not as energetic. Mark constantly pulls all-nighters before exams, always stresses out, and never exercises. The time is 6 AM on a Friday and Mark has forgotten that he promised to go jogging with Anne. In his frantic state, Mark dresses quickly, forgets to eat, and then he heads toward the hospital park where Anne is waiting. Mark has finally arrived at the hospital park and he and Anne have been jogging a good hour. The time is now 7:30 AM and it is a scorching 90 degrees. Let's pause and think about what predisposing factors of syncope Mark has been exposed to. So far the following factors have arised: the psychogenic factor of anxiety, and the non-psychogenic factors of heat, hunger, and exhaustion. Let us not forget that Mark is also 20 years old. Young men from the ages of 16 to 35 are more prone to syncope. Let us watch the next scene and observe how Mark exhibits pre-syncope. Mark has now gone into pre-syncope. Pre-syncope is characterized by warmth, pallor, cold sweat, nausea, and an increased pulse. What follows pre-syncope next is syncope. Syncope is characterized by breathing changes, pupil dilation, bradycardia, and lowered blood pressure. In the next scene, Mark goes into syncope. A medical doctor so happens to be on a lunch break near Mark and Anne, and he eventually comes to Mark's aid. Observe what the doctor does to manage Mark's syncope. Let's review what we have just observed. When managing syncope, we must follow the following steps. Step 1. Recognize the problem and assess the patient's consciousness like an. Step 2. Summon help. Step 3. Position the patient supine. Step 4. Assess the patient's airway, breathing, and circulation. If definitive care is needed, additional steps must be followed. Step 5. Loosen tight clothing. Step 6. Utilize an ammonia inhalant. Finally, Step 7. Administer oxygen if necessary. Remember that in a dental setting, treatment is halted and the patient must be escorted home. Lastly, in regards to management, if the patient is pregnant, we must remember to position her on her right side instead of supine. Now going back specifically to Mark's case. Did you notice his post-syncope manifestations? In post-syncope, the patient is usually confused, and they experience an increase in blood pressure and pulse. It should be noted that once you experience syncope, your likelihood of experiencing it again is greater. Lastly, the pathophysiology of syncope. In pre-syncope, you have an increase in epinephrine and norepinephrine. You also have increased blood flow to the tissues, but decreased circulatory blood volume. In syncope, the heart cannot pump the necessary blood to the brain. You also have decreased blood pressure. In post-syncope, the patient recovers. The body is however fatigued, and it may take 24 hours to recover. I hope that you found this to be truly educational. You are now armed with the knowledge to combat syncope. I wish all of you the best in clinic. Cheerio.